Great. Thanks, Carly. Good morning, everybody. Welcome back to the 25th, I think, panel review meeting. Thanks for being here on a wintry morning for County Laurel Hill Center is the applicant. I'm going to copy and paste the reviewers into the chat so you can look for your name to get yourself ready to go, which includes me today. So I'm trying to get that also ready. And many thanks to Ariana for putting together a little cheat sheet to help make the report out a little more succinct. And then we'll move on to Yamhill and Union counties. I do want to share with folks that the Oversight and Accountability Council has already approved 24 counties, and y'all have approved 31 counties. So I really appreciate all of the work to move forward. This is sort of a panel reviewers beware. The OAC is right behind us. So we're going to really need to figure out how to get through some of the biggest counties together. So thank you in advance to Ariana. It would be amazing if y'all could spend like a half an hour and get yourself well prepared so we can pick up our pace and be transparent and deliberative and also get through all of the information we need to get through. I'm going to do a very, very quick overview today. And because we are starting anew, I'm going to share my screen and do a call for conflicts for Lane County after Carly takes attendance. Go ahead, Carly.
Okay, Amy, you here? Norma let me know she was going to be late. Keisha? Morgan? And Zeb is going to be late as well. Abby?
Here.
Ariana?
Here.
Ane? Dana?
I'm here.
Danielle? Daniel?
Daniel is here. Good morning.
Good morning, Daniel. Danielle?
Here.
Drew? Elizabeth?
Here.
Evelyn? Grace? Gregory?
Here.
Greta?
Here.
Hannah? John? Juliana?
Here.
June? Kathy?
Here.
Kylie?
Here.
Kirsten? Liz?
Here.
Mark?
Here.
Maya?
Here.
Megan? Michelle?
Here.
Nicole Corbin?
I'm here.
Nicole Egler?
Here.
Rachel?
I'm here.
Is Sam here today? I did not see her.
No, he's at that meeting with Kristen
Okay.
and others.
Sarah Adelhart? Sarah Hubner? Sean?
Here.
Stanley?
Here.
Tammy?
Here.
Tatiana?
I'm here.
And Tim?
Here.
We have quorum at 23.
I could be wrong, but never mind. I'm not going to make any assumptions. All right. Any questions or comments before we get started again with Lane County? Okay. I'm going to do a quick call for conflicts. On the right are all of the providers. And as soon as my, um, it won't move. You know what I'm going to do? I'm going to do this differently so I can see everybody. I've got a little window that's covering up the list, which is not very helpful. But I'm going to pick up right where we left off, reminding folks that this is a public meeting. Please not share sensitive information, summary about Lane County. And our job is to make final funding recommendations to the OAC. And the applicants are here on the screen. Act on Recovery, Addiction Counseling and Education Services, Black Thistle, Street Aid, Boulder Care Provider Group, Center for Family Development, Community Outreach through Radical Empowerment, Daisy Chain, HIV Alliance, Housing Our Veterans, Ideal Option, Insight Recovery Northwest, Laurel Hill Center, which is where we're going to pick up. Live, Grow, Share, Looking Glass Community Services, Oregon Outreach Clinic, Oregon Recovers, OSLC Development, Plaza de Nuestra Comunidad, Restore Connections, Peer Center, Shelter Care, The Fourth Dimension, Transponder, True Colors Recovery, Veterans Legacy, Whitebeard Clinic, and Youth Era. Are there any actual calls? Are there any actual or potential conflicts today? Okay. Before we dive in, I'm starting to do a bit of a bigger reminder for both the panelists and for the OAC meetings that what is required of us is to only report and reflect on the information provided in the application itself. And sometimes that can be a challenge because we all come from our own areas of expertise, and y'all are subject matter experts, particularly on substance use disorders, community engagement, and other systems. But to be really careful and thoughtful about what type of outside information you bring in, and to avoid that as much as possible, because you might be subject matter experts and have significant expertise, but if information is not included in the application, it should not be discussed. And there's no way to really fact check it and really determine accuracy. So we want to be really cautious and aware, particularly because there are applicants and members of the community watching. We want to make sure that we're uplifting only the information provided through the application process. Okay, and as a reminder, we're about to dive into a challenging conversation because the countywide formula for Lane County is 38.9 million and the asks are 142 million, which is $103 million over. We are going to pick up with Laurel Hill Center, the existing grantee, and reapplying for funds on the left. It is 1, 2, 3, 4 from the bottom. And our reviewers for Laurel Hill Center, which you have in the chat, but verbally are Nicole Corbin, but we moved on. No, Nicole Silva, but who is not here today. Nicole Corbin, do you have your materials ready to go?
I believe I do.
Great, hit it.
All right. I apologize. I'm working on, like many people, there's closures here due to snow, so I'm working on a single, very small screen. So I will welcome any additional help from Kathy or anyone else who is reading. But for question 7, Laurel Hill Center is not a culturally or linguistically specific provider. Persons from all cultures are served, and Laurel Hill Center uses translation services and/or makes referrals to culturally specific providers as needed.
And we know they are not the CMHP. I'll help you along a little bit. And they are only applying for housing. What kind of housing are they wanting to do for 3.6 million?
They are wanting to expand on a housing program that was previously funded with Measure 110 dollars. It provides supported housing services and rent assistance to individuals with mental health related disabilities and co-occurring mental health and substance use disorders. They've been operating a rental assistance program since 2014.
Okay. Anything else?
The peer services that they engage is a partnership by providing housing navigators and peer support specialists who have their own lived or living experience of homelessness, substance use, and mental health concerns. So since they are housing only, the peers would be engaging with individuals in their housing setting.
Are any of the peer FTE included in the housing budget?
They are included. There's a program director at 0.5, housing coordinator at 0.25, housing navigators at 2 FTE, and then they have support staff, a rent educator, and a finance staff. And those are all 0.15 FTE.
So it sounds like they built the whole program, program costs and peers, not into the
Correct.
service area, but into housing. Okay.
Yes, absolutely. Most of their, a good portion of their funding over the 4 years is underneath the rental assistance, which over 4 years, it's 2.2.
Fabulous. Thank you both. Any questions for Nicole and Kathy on Laurel Hill Center? And Amy Madrigal is here now. All right. Thanks, Amy. So I put in the chat, Measure 110 team, you're up for Live, Grow, Share, because both of the reviewers are not here today.
I'm here.
Oh, you are here.
Yeah.
Hi.
Hi.
Oh, tomorrow you can't be here.
Tomorrow.
I'm
Yeah.
confusing my days. Well, welcome.
Thanks.
Go for it, Rachel.
Okay. So the response for number 7 is a little long, so I'll dive right in. Live, Grow, Share prioritizes providing individuals access to behavioral health providers from the same culture whenever possible. Our organization employs staff to include diversity in the following areas: race, ethnicity, age, language, gender identity, sexual orientation, religion, spirituality, and other intersectional underrepresented identity groups. Each staff member and provider are hired not only based on their expertise and qualifications, but just importantly on their diverse lived experience and the willingness to share these experiences when appropriate to support another's growth and healing. Our diverse staff run culturally specific programs and groups such as Dragonflies, peer mentors for parents involved with child welfare, integrated co-occurring disorders treatment, spiritual, all religions and theories welcome, peer support, grief and loss, medical IDD peer support, women's trauma group, and the Indigenous specific peer support. Coming soon, we have affected other/family support groups, veteran survivors of sexual assault, veteran services, parenting, and more. All agency resources are ADA compliant, set up for the most independence possible. Each staff member is trained and educated in trauma-informed care, the impact of culture on mental health, and diversity, equity, and inclusion. When a cultural or linguistics specific service is unavailable at LGS, we provide participants access and transportation to community-based support groups and services addressing client issues. Interest in any other services that will enhance engagement. Our therapists are also trained to support letters for gender-affirming surgery. M110 funding would support the organization in prioritizing new hires of BIPOC, bilingual, LGBTQIA2S+, and young adult individuals. They do bill Medicaid, but these funds would only be used for non-Medicaid eligible expenses. Their peers are both in the field and the office. I think primarily in the office though. They are integrated into screening and assessment in the office, SUD in both the field and the office. Housing in the office, but this part was unclear to me because the way that they had it, the language around it, I couldn't quite get a sense of where they'd be offering the services, but it will be managed by one peer support FTE. So that's kind of the direction that they're going with that. And then they provide harm reduction services integrated into their peer support in both the field and the office. And then for housing, they're providing rental assistance, so $6,000 per month per person to serve 10 people per month is the way that they have those funds structured. And yeah, and so the transitional housing piece is a new service category for them. So it's kind of a new layer of funding.
Okay. And harm reduction looks like one of the 2 reviewers recommended there's $40,000 there.
Yeah, I don't know. Let me look at my notes on the harm reduction. I feel like that was a little unclear. I can see if I was one of the ones that supported that or not.
Like Kathy's got some intel.
Oh, thank you, Kathy. Yeah, too many things to look at.
Yeah, on the proposed budget narrative under harm reduction, they say most harm reduction supplies are covered under Save Live Oregon's clearinghouse. Would cover items that are out of stock or unavailable, such as socks, hat, gloves, testing strips, snacks, water, etc. Estimate to give supplies to 10 people per business day.
Thank you. Any questions about this application and the services they'd like to do as a part? We'll take it.
Either way, I'll do it. You got the heavier lift.
Oh,
I'll do it.
great.
It's a long answer again,
Yeah.
so here I go. Okay. Looking Glass prioritizes the voices and needs of youth and young adults in our service delivery. Our policies ensure confidentiality, privacy, and access to services designed specifically for young people, including flexible scheduling and youth-focused spaces. Services are provided from a relational perspective, recognizing the importance of incorporating parents and caregivers and others important to the lives of youth in treatment. Services are provided at several locations, at schools, and in the community. We understand that youth have intersectional identities and needs. All program materials, paperwork, substance use treatment, mental health services, skill building, case management, and peer support are offered in Spanish. Looking Glass has a BIPOC specific community outreach coordinator. Looking Glass offers a monthly BIPOC specific consultation to staff working to support high quality services. When working with Indigenous youth, our staff collaborate with ICWA representatives and tribal members to ensure that the cultural needs of the service recipients are being met. We provide opportunities for youth to participate in community-based tribal activities or rituals. Looking Glass has an LGBTQIA2S+ coordinator and a clinical supervisor and youth peer support specialist. We offer monthly LGBTQIA2S+ specific supervision and annual staff training. I'm going to say this a bunch more times. LGBTQIA2S+ specific services. We provide comprehensive gender affirming care. We offer training to staff on LGBTQIA2S+ care, and several staff have been trained to provide gender affirming care medical letters. When specialized care is beyond our immediate scope, we provide warm handoffs. Hold on, I just lost my, where did I, okay. To trusted community partners who can provide additional services, including disability services. We adhere to accessibility standards and provide accommodation to ensure individuals with disabilities can fully participate in services. All program materials and paperwork are printed in dyslexic-friendly fonts for additional accessibility. Staff are trained in various communication methods, including the use of simplified language, visual aids, and assistive technology. We use multiple types of assisted technology, including services through Accessibility Northwest, Lane Care, Lane Education Service District, Mobility International, Commission for the Blind, vocational rehabilitation, international translation, and assistive technology not limited to Alpha Smarts and sensory integration tools. Our services include flexible access and support for caregivers with minor children. Our shelters are designed for youth who are parents and their children to stay together in shelter for their entire stay. Our shelters are some of the few in the state that allow single fathers to stay with their children. We provide compassionate, non-stigmatizing services across the perinatal period.
Okay. So Looking Glass has a screening request of $2.7 million. Their assessment is 224 and SUD is 537 and housing is 14 million. So really focused in on the housing and the screening. I'll share my thoughts as the reviewer and then Rachel, please take over. So looking at SUD, they are not going to, they would not be billing for anything Medicaid eligible. They'd be filling gaps to accelerate access to care. And for housing is primarily their shelter, and it creates immediate and low barrier, and intensive supports for that shelter, and it includes a significant amount of full-time including, uh, a program manager, program supervisor, admin assistant, 4 peer counselors, 4 peer counselor supervisors, 12 peer counselors, 2 registered nurses, 8 certified nursing assistants, 3 case managers, maintenance cook, and other. I was really impressed by this application and thought that shelter was an incredibly needed service. And frankly, just also had a lot of sticker shock about how that was going to be feasible. And my other comment about this application was around the screening. And I think a lot about Keisha and her questions about screenings for all of these applications. And there includes for the Burn Hotline peer screeners at 6.3 FTE, in addition to parts of so Burn coordinator and a Burn Hotline trainer as well. So I thought this was a fantastic applicant. I just was concerned about the level of request because it's half of the county's formula, I believe. 17 million is the total ask. Rachel, anything else you would want to add?
I mean, I think I agree with your sentiment. They have a very robust application. They're very thoughtful, lots of detail, and yeah, it's a lot of an ask. So hard to figure out how to prioritize that. So,
Kathy?
It is a very wonderful application and stuff, but what I did note is that they are a previous or existing grantee, and in this application on their workbook, they were awarded 7.3 million, and they still have 4.6 million to expend. So they've had this for a number of years, and they still haven't even expended half of what they've been awarded. So that's the one time I do have concern over this, whether or not they're expending their funds and the award amounts being excessive.
Any questions about this applicant? Or any clarifications? I'm going to move on to Oregon Outreach Clinic, which was randomly assigned to me. And Sarah Adelhart, who wasn't here a minute ago. Sarah, if you are here, feel free to jump in. Their answer to question 7 is Oregon Outreach Clinic accepts referrals from adults and adolescents from diverse backgrounds, but provides services primarily in English. For clients requiring additional language support, OOC partners with Linguava, a Portland-based provider specializing in healthcare interpretation, offering services in over 230 languages through various platforms, including in-person video, phone, and text. For the current project, case managers will connect clients needing culturally and linguistically specific services to appropriate resources. Oregon Outreach Clinic is applying for $931,000 for assessment and SUD at 1.1 million. It would not be billing for anything that's Medicaid. It is for other than non-Medicaid services, and also is for startup costs because this is a new applicant. They also in Lane County, and they also indicate their cost for SUD would be on hiring and training and other. I can't read my writing. Oh, coaching to get this service up and running. They did not apply for peer or housing or harm reduction, and that's the end of the report for that applicant. Any questions for me? And I can go in to see who's next, which is Oregon Recovers, which is Stanley Minity and Sarah Howard.
Hi, I don't think Sarah's here, so I think I'm on my own.
Great,
All right.
thank you.
So for question 7, it's kind of short. We do not currently provide this, but can and will immediately adapt the website and mobile app for Spanish through direct translation as soon as we are able, with other languages coming soon through audio translation. Does it have peers? It has peers, but this is for an app. So I'm not sure. In the application, it talked about hiring a peer for each county to navigate for recovery services, but it didn't say if they were going to be mobile or in the office because it's an app. So I'm not sure if they're going to be out and about or not. Um, the other one that they didn't do housing, they didn't do SUD, they did harm reduction, and the harm reduction was for, and the app is Recovery Network Oregon, and it's to have access map and overdose prevention training program, and they have teamed up with a sought after expert for being an instructor for training, and they also discussed Narcan kits, distributing them in Lane County. And they talked about how they travel to events. So this is in the office and out of the office, but they didn't. That is about it on what they provided for that information.
Okay. Yeah, that rings true with that organization, what we've heard from other applications in other counties. But
And oh, I forgot to also add that they do not have the ability to bill Medicaid and other insurances. I forgot to add that. Sorry.
okay. Thanks, Stanley.
Thanks.
Do you have a
Next.
question for Ariana or someone from the team? The peer support request for the app at 253K doesn't have a color. Do we know if it was green, blue, or orange? And I'll see if there's any before we move on to OSLC development.
Let me see. Let me get back to you on that
Okay.
in 1 second.
Great. No problem. Just wanted to make sure we're clear. All right, so and I'm hearing no other questions. We're going to move on to OSLC development, which is again Stanley, joined by Tatiana.
All right, I'll read question 7 and hopefully Tatiana can help out a little bit too. All right, question 7. Again, this one doesn't have a lot of information on it either. Although the ODI clinic does not offer cultural and linguistically specific services to particular communities, our services are culturally and linguistically responsive as described below. And so they're talking about question 8, and they went a little bit more in explaining in question 8. All right. The billing of Medicaid. It's a little more detailed. It said that ODI clinics are licensed with the state of Oregon to provide outpatient substance use and mental health services. The ODI clinic is credentialed to bill Medicaid for those services, and the clinic receives payments from the Department of Human Services Medicaid Management Information System. The clinic also receives Medicaid payments from Pacific Source, CCO, and Trillium CCO. The ODI clinic is not paneled with private insurance carriers.
Thanks, Stanley. Kylie, did you need to jump in? No, guess that hand was an error.
Oh, sorry. I was talking and did not realize I was off mute. The hand was to reflect Kathy's answer that is in the chat right now, which regarding to Oregon Recovers, which is that in attachment A in their application, they did only choose harm reduction. However, in the budget, they do have line items and a budgetary amount for peer support, in which both reviewers put NA as their scores for that because it is not indicated anywhere within their application.
And confirm.
Okay. Thank you.
So I wasn't quite sure how to mark that
What color to give it, because NA isn't a color.
exactly.
Okay. Thank you for the clarification. Stanley, back to you. So they're Medicaid not going to do, did you talk about peer supports and whether they're office or?
No, I'm getting right there. Peer
Awesome.
support. I used Adriana's little sheet and it's easy to break it up. So yeah. It's both. It looks like from their application that they'll be in the community and in office. Screening and assessment. It's interesting. It's office and online. So I didn't know how to put in person or not because it's online too. SUDS will be both. Housing, they are not doing. Harm reduction, they're not doing. And just an FYI, this is for screening. They're doing a hotline and screening prevention for parents. This is for youth. And the assessment and low barrier substance use is school-based and mobile. And that's what I have. I don't know if Tatiana has any more to add.
Yeah, I would just add, just overall really strong application. I think the area that there was the least amount of detail was in peer support. It appears that this will be a new component of their work. They were previously funded. That budget for 526, I believe in the budget they were proposing 2 new peers to mostly be engaged as part of their mobile van expansion. And so that kind of question mark if we did go forward wanting to get a little more information about that since that had the least amount of description in the overall application.
Thank you. Any other questions?
I was going to say this to Stanley. I'm also going to agree with Tatiana. They had a really strong application.
Love that. Thank you. And Tatiana is up next, and I don't know if Zeb has been able to join us dealing with weather inclement stuff. Also for Plaza de Nuestra Comunidad.
For number 7, it's quite a long description. They are a Latino serving organization, so culturally responsive and culturally led. In this section in general, they just did a really nice job just talking about their deep historical roots of the Latino community and just all the other ways that they are really working within that Latino provider network and system. So that was certainly one of their strengths. Just glancing through their chat, my cheat sheet. They proposed, I believe, in almost every category except harm reduction, which I think is on the screen. They had pretty ambitious proposed projected number of clients to serve in treatment, a 30% increase annually. And so just that was exciting to see, but also just wanted to make sure that if we go forward with funding, that they have a clear plan and for why they believe they can ramp up that quickly. They do facilitate referrals to housing and provide rental assistance support. Overall, they just, again, had a really strong application. They clearly are engaged and can reach the community. They're doing a lot of really important work around mixed documented and undocumented status people, given, the overall environment we're in right now. And again, a really comprehensive budget across 5 of the 6 domains.
Thank you.
In general, just, given their role in the community, just seem like they're filling an important gap within the overall burn ecosystem.
Thanks, Tatiana. And I do have a question about if you could look at their program costs at $5 million on their budget. Because one of the things the OAC is asking for is looking at reducing total grants using kind of a function of admin as a way to find a way to a lower amount to fund more providers. So could you share a bit more of what's in the program cost?
It looks like most of their program costs are really around that infrastructure and admin piece, right? Receptionist, billing staff, billing compliance specialists, so kind of that administrative infrastructure. So given the ask, it sounds like that they have or see this as an important kind of foundational support. They do have a couple of caseworker positions that are included under program, and they don't appear to be in the other kind of intervention areas. So that might be an area where we could work with them to see if those could be shifted over into one of the other service areas and out of the admin and program costs.
Thanks for summarizing that so well. Appreciate it. Any questions for Tatiana? All right, Rachel, and Zeb, who thanks Curly, he's not, indicate he's not here yet. We've got Restored Connections Peer Center. And this is one of those situations where the budget is primarily built into the program cost section of the budget workbook, but this is just an application for peer support. And y'all have seen those $16 amounts get populated when we receive a workbook with something in it. We want to make sure we're reflecting what we receive and not making edits to anything we receive from the contracts folks. So Rachel, over to you. If you could read question 7 and tell us about their peer support offerings.
Okay. So for question 7, RRCPC, what is it called? Restored Connections Peer Center, sorry, services several specific cultural communities, including veterans and Indigenous and Native communities as described elsewhere. We deliver inclusive services for our LGBTQ2SI+ communities, recruit staff from this community, engage transponder to ensure we have the most accurate training to reduce microaggressions, and facilitate a safe group setting for the queer community to express their culture. We provide translation tools for our Latinx and Spanish-speaking communities to navigate services within Lane County's Latinx burn provider. We support our staff in honing their Spanish language skills by enrolling them in Spanish language classes. Our CPC mandates all employees have a variety of marginalized personal experiences, which is the heart of peer-delivered services. The RCPC team consists of individuals with lived experience in substance abuse, criminal justice, and/or courts corrections, as recommended by SAMHSA as a best practice to advance recovery. A cultural perspective in recovery support is required to effectively promote health, wellness, and purpose. So their funding, they describe that Measure 110 does not supplant current contract fee for service funding from Pacific Source. That's what I had in my notes. Our peers in the field are office. I think it's both. I think they do some outreach events, but it's primarily office-based. I had a hard time discerning that. Their services include, so they're peer focused. That's their model is a peer support model. So all of their services are integrated. They don't apply for their last funding period. They didn't apply across the full scope of categories. They just applied for peer support. This time they're naming that they provide services across a variety of categories, but are still only requesting those limited. So they provide housing support, supported employment, peer professional development, zero barrier drop-in center services, and medical access. So they support with recovery housing placement. So I think it sounds like their specialty is really for folks who are getting out of treatment or residential treatment services of some kind, that they help support them into temporary transitional housing. They provide, yeah, that's what I just said. See, and then they don't have anything in the harm reduction supply offerings.
Great. Thanks for the summary, Rachel. Are there any questions for her on Restored Connections? Okay. Amy, you are up for shelter care next, since we still don't have Zeb with us because of the weather. Amy, you're muted. Looks like she might be on the phone. We're going to need to come back. We're going to move over to 4D, or the Fourth Dimension Recovery Center, and that is Dana and Amy. Dana, are you available?
Yeah, I'm here.
Great.
Okay, so for 4D, their answer to question number 7 is 4D believes that adolescent and young adults fit the definition of culturally and linguistically specific services, and as such, has developed an age-specific peer best practice manual that supports adolescents with tailored programming. And then in regards to whether or not their services are Medicaid billable, their answer was a little wonky. So this is Lane County. However, their answer was geared around Jackson County. So I'm just going to read what their answer was. It says, in regards to billing Medicaid, they said no, but 4D is preparing to open substance use and mental health treatment services, but not in Jackson County. When 4D is approved to provide Medicaid services in Jackson County, it will take considerable measures to ensure no supplanting occurs. 4D will ensure that grant-funded services are offered to those ineligible for or refuse to utilize Medicaid reimbursable services. So it might have been a copy paste situation, but their idea in regards to billable services is probably applicable across counties, is my assumption. But so that was their response for that. And then in regards to their peer services, they have a single young adult recovery center where they do provide outreach and engagement into the community, and they distribute Narcan to reduce overdose. So the funds that they're asking for covers multiple different staffing. So a supervisor, 3 peers, 1 outreach supervisor, 3 outreach peer supports. And they're not asking for housing. Their harm reduction, they indicated that they're doing some harm reduction supplies, including Narcan, HIV test, STI tests, syringes, etc. And I think that's it.
Fantastic. Thanks, Dana. Any questions? Okay. Let's move to transponder, and I lost my list of who's reviewing.
I think that's me again.
It is, and Daniel.
And also me, yeah.
Great.
Yeah.
Go ahead, Dana.
Oh, sure. Okay, so Transponder, their answer for question number 7. Transponder provides culturally competent services designated explicitly for the LGBTQIA2S community, focusing on transgender and gender diverse Oregonians. We prioritize safe, inclusive space where identities are respected and supported, offering services such as peer support, mental health resources, and gender affirming care. Regarding, Daniel, did you have anything you wanted to? I think I read it all. I think I got it.
Exactly.
Okay.
Yeah, their answer was very short, so yeah.
Okay.
Well,
Okay.
I have to.
And then in regards to Medicaid billable services, their answer was a little complicated in regards to that they do hold a certificate of approval from OHA, which does allow them to bill for eligible services, but they just don't have the staffing that allows them to bill for the services is my understanding of their response. They did mention that they do not intend to use the grant funds to provide services that would otherwise be covered by any other source. They're working to expand upon the services to address the broader mental health and social support needs of the LGBTQIA2S community. And some of the services that they have indicated for this grant aren't Medicaid billable. So trying to make sense of what they were saying. I think they're working towards wanting to have their services that are delivered be billable and reimbursable at Medicaid, but they're just not quite there yet. Is that what you understood, Daniel?
Yes, and I think that in order to do that, they want to hire a qualified mental health professional, so they are able to bill for these services. And they said in their application, and I think that you said it, but they are ensuring that the measured one-time services remain available to those who are in need while providing the full spectrum of care required to support the overall well-being of the population they serve.
And so is there anything you wanted to add about the program costs?
I would mention that I think for transponder, I didn't support the screening, and the reason in my mind that I landed on that decision was because when I was reading their budget notes, predominantly the funding would be for staffing, and it was non-clinical staffing. So it was a program manager, a program director, and then a 0.8 FTE for peer delivered service. And the number of individuals that they indicated that they would screen over the grant period was only 193 individuals. And so and screening is a covered service under Medicaid. And so if they were billing, we would that would only equal about $9,000 of reimbursable services, and their ask is $408,000. So I was having a hard time justifying their ask in regards to the amount of individuals that were going to be screened. So that's why I said no to that. But I did like the thought of the cultural specific population that they are serving. And I thought the other peer and housing and some harm reduction their ask was okay. So that's where I was at with them.
Any other input, Danielle?
No, I think that Dana said very well, and I also agree that and let me see to get it from my notes here from the original rubric. Yeah, I also put that although the application did not make any strong case about screening procedures, I would still feel that that aligned with their peer support services, that they would benefit from receiving the screening services, and that's why I said yes.
Thank you both. Any questions for Dana or Danielle? Okay. Amy? Amy, can you hear me? Yeah, there you are.
Sorry,
You're
I
okay.
I had an interruption. What is the motion?
No.
What's going on?
Life happens. I need you to report out on shelter care. Do you have your materials ready to go?
On which one?
Shelter care in Lane County.
We grab it. I'll have my stuff in like a second. 1 second.
Why don't we move to True Colors Recovery, and we'll pop back to Amy when she has a minute. Great. So True Colors Recovery is Danielle Cartwright and Danielle Garcia.
Okay, I can read the question 7 statement. So for True Colors, it says we actively conduct outreach in BIPOC communities to invite marginalized groups into our services, ensuring inclusivity and accessibility. Our intake forms are translated into Spanish, and we have 2 staff members who can provide services in Spanish to better support our diverse participants. Additionally, we have hosted recovery meetings exclusively for BIPOC members, creating safe and focused spaces for healing. We also held a Wellbriety meeting at our center, further reflecting our commitment to culturally specific recovery support. And then moving on to the Medicaid billing, they don't bill Medicaid. Their peers are both in office and in the field. And it seems like their hope with this round of funding would be to open up another drop-in recovery center, because I think their one that they have is based in Portland right now. Their housing is transitional housing. Or I'm sorry. Yes, their housing is transitional housing. And I think, and their harm reduction is naloxone based. Did I miss anything, Daniel?
The only thing that I have here is about the screening. I really didn't see any numbers in the budget tab for that, and I think that they're requesting screening services. Did you catch that too?
I had screening noted as NA.
Ah, okay. Okay, so then yeah. All right, so that answers my question.
Thank you. Any questions on this applicant for True Colors Recovery? Thank you for that summary. Amy, we're going to go back to you and shelter care.
Shelter care. Okay, so I thought in Lane County I did 4D recovery, but I'm looking because not finding shelter care. Give me just a second.
All right. If not, we can have the.
There it is. I got it.
She got it.
Got it.
Awesome. Awesome. So
Got
if you
it.
could read in their project scope, if you could read the answer to question 7, and then share for their peer support and harm reduction, whether the peers are in office or field, and for harm reduction, what is the menu of services they would like to provide?
I'm not having a good day if you can't tell. Okay. Oops, now it's opening. Trying to open the right one. I'm sorry. Okay, go. Shelter care. Oh my God. Sorry, I'm having computer issues.
That's all right. Want me to come back?
Maybe. I think I got it. My God. Oh, no, I want to try it now. Get off my screen. Yeah, come back.
Okay.
Everything keeps popping up.
No problem. We're putting a pin in shelter care. We're going to pop back over to Veterans Legacy. And those reviewers are David Course and Danielle Cartwright.
Okay, let me grab this. So for question 7, it says, yes, Veterans Legacy Oregon provides culturally specific services to the veteran population. Although this might be considered a niche segment of the potential populations that could be served from a local, state, and national viewpoint, there is no doubt that improving services at all levels for veterans is imperative. Our experience to date shows almost universal dual diagnosis status, i.e., drug and alcohol abuse coupled with secondary diagnoses, often trauma-related, example PTSD, for individuals that are admitted to Camp Alma. Numerous studies validate a more robust improvement of many parameters when veterans are housed/treated together, whether in a residential scenario, incarceration, etc. There's a tendency in the veteran community to develop a distrust of the government, clinical settings, and of the civilian community. Many veterans are only able to let down their guard and begin to heal when they know they are in a welcoming, safe, and non-clinical environment with other veterans. And then for Medicaid, They do not directly provide Medicaid or insurance reimbursement services or receive Medicaid or insurance reimbursement, so Measure 110 funds cannot supplant those funds. Their peers are in the office at the Camp Alma that they refer to. Their SUD and housing peers work, or their peers work with the SUD and the housing. And I know their one thing that they're trying to implement is equine therapy, and the peers would be involved in that. And it is transitional housing that is held again at Camp Alma, and they did not select harm reduction.
Great. Thanks for the summary. Any questions or other input? Thank you. Amy, checking back.
Yay, it's a miracle. I'm ready. Okay.
Awesome. So, shelter care. Question 7, please.
All right. Is very short and simple. The shelter care does not provide culturally and linguistically specific services to a specific cultural community. However, shelter care does utilize translation services when needed and is able to refer participants to culturally specific services as needed. That was the answer to number 7.
Awesome. Thank you. And they only applied for housing. Could you share what kind of housing, shelter, well, shelter care, transitional rent support, what are they looking to use the funds for?
So, they're okay, so their type of housing is, let me go up here. Sorry. They will be providing temporary shelter for individuals that are seeking treatment services through the burn and who are currently experiencing homelessness. Shelter Care is a housing first organization, which is an evidence-based best practice. Therefore, we believe that individuals must first have the safety and security of housing or shelter before they can focus on their goals, such as sobriety, or behavioral health, or physical health and wellness. They know that lack of housing is a barrier for many individuals who want to seek treatment. And by providing housing, we are lowering individuals' barriers to access treatment. They said in August of 2024, there were 4,001 individuals unhoused in Lane County, according to Substance Abuse Mental Health. Let's see, what else? So, they have 7 one-bedroom units for individuals who are referred through the Behavioral Health Resource Network through the burn. The units will be for individuals who are seeking drug and or alcohol treatment services who are currently unhoused. Individuals will stay at the shelter for up to 3 months with the opportunity to extend the stay for 1 month at a time. Each private unit comes fully equipped with a kitchen, bathroom, and bedroom. While in the unit, the participant will work with a shelter care housing specialist to prepare a goal plan to secure more permanent housing. These funds will give us the opportunity to serve an additional 17 individuals per year. This number is based on average length of stay from the previous burn participants and also takes into account unit turnover time. The units are on the Lane County Transit bus route and also have parking available for tenants and visiting service providers.
Great. Thank you, Amy. Appreciate it. Any questions for Amy before we move to Whitebird Clinic? Okay, thank you. That's Liz. You are here.
Yeah.
And I don't think David is here. David, interrupt me if you are. Go for it, Liz.
All right. For question 7, WBC's commitment to diversity, equity, and inclusion is established policy. Whitebird has the administrative capacity and experience to successfully ensure equitable service delivery. WBC staff and board members demonstrate knowledge of the lived experience of community of the community we serve. The agency's services have been designed to address cultural disparities, including those of race, ethnicity, gender inequality, and homelessness. For example, WBC offers bilingual Spanish services provided by native speakers and promotes an understanding of the Latinx cultural lens regarding physical and mental health, which is critical to providing meaningful care to Lane County Spanish-speaking residents. Spanish is the most common language other than English spoken in Lane County. Therefore, culturally and linguistically specific services are designed for and delivered to our Spanish-speaking community members. The delivery of WBC's culturally and linguistically specific behavioral health services is embedded and ongoing, and the staff of these programs have engaged in trainings designed to increase staff cultural competence in working with culturally and linguistically diverse clients, as well as a language certification course package for staff members fluent in Spanish. In addition, WBC's behavioral health team contracted with the Spanish language clinical supervisor, LMFT, CADC2, and CGAC to provide culturally competent care. The new clinical supervisor has guided staff towards an increased level of cultural capacity and awareness, improving health equity and quality of services. Providing decades of service to the community has led WBC to develop culturally specific care for unhoused individuals. This approach also embraces the culturally specific needs of the diversity within this subculture, including LGBTQ+, BIPOC, and others. That understanding guides service delivery, reducing barriers to accessing care and meeting people where they are. For question 2, this organization can and does bill Medicaid. They are wanting to provide peer services, which are already established. They would provide support during non-business hours, both in-house, and they also intend to expand their community outreach by doing twice weekly campsite visits. They did not apply for housing. However, I noted that they do have a significant line item in their budget for motel vouchers and rental assistance that they put under harm reduction. So that might be something just to take a look at. Their harm reduction and treatment center services are funded entirely through Measure 110. They use the funds to pay for harm reduction supplies, including blankets, tents, and tarps, harm reduction kits that include fentanyl and xylazine test strips, and they have a Fourier transform infrared spectrometer that can provide real-time information about drug content and any harmful additives or impurities. And they also intend to do harm reduction outreach twice weekly to camps.
Awesome, Liz. Thank you. Any questions for Liz about White Bird Clinic's application and offerings? Okay, and I know Tim is on the move, so if someone could please report on his summary for the Youth Era application, please.
Youth Era number 7. While Youth Era does not exclusively serve single cultural or linguistic community, we are committed to ensuring that our services meet the need of diverse youth populations, including BIPOC youth and those whose first language is not English. To achieve this, we prioritize hiring multilingual YPSS from a wide variety of cultural backgrounds, ensuring that youth can access support from providers who share their identities, experiences, and linguistic abilities. If we're unable to offer a culturally or linguistically appropriate match within our staff, we collaborate with community partners to facilitate connections to culturally specific resources. Through these partnerships, we ensure that every youth, regardless of their background or language, receives recovery support that is accessible, inclusive, and culturally responsive. And they are only offering or asking for peer support and like they collaborate with all of the local tribes and so forth. And their proposed activities is to retain the current recovery YPSS to meet the demand of the community. They have this broken up into proposed activities, and that's why it's difficult to have it all in one big paragraph. They provide one-to-one peer support and recovery groups and offer resources and system navigation to help youth build resilience and achieve recovery goals. They conduct community outreach and strengthen partnerships with local schools, service providers, and community-based organizations to reach youth needing recovery. So they're active on this, boots on the ground. They do provide harm reduction tools and basic needs for resources to help youth maintain recovery and access to essential services. And they provide weekly supervision to recovery YPSS staff to ensure service quality and professional development.
Thank you, Kathy. Appreciate you covering. Any questions that Kathy might be able to help answer? Okay, y'all, that is the end of Lane County in terms of the providers. I want everyone to take a deep breath because we're going to move into the harder part. So here we go. All right, Ariana, I'm going to just share what you have prepared here. I know it's small, but based on how the OAC has been working and the prioritizations they have been voting on, which includes funding existing and culturally specific providers. Also been working with the base that the formula indicates, and for Lane County, that is a $5 million cap base guide. That is true for all extra large counties in Lane, Multnomah, Washington, and Clackamas are all the extra large counties in the state of Oregon. So that's what you're looking at here. This is a list of all the previously funded applicants. The totals going not over $5 million. And you'll see that, recall, there were some like 15, 17, $12 million asks. So this would be a significant reduction for these folks. And even bringing the total for those significant reductions for only existing grantees brings it down to $62 million, which is still way over the county formula, which is 38.9. Also applying a 70% across the board reduction, not 70% reduction, but 70% of the ask, or a 30% reduction, which is another metric the OAC has asked us to prepare for them, brings the total for these existing applicants down to 43.7 million, which is about $5 million over the formula. And yes, this is absolutely heartbreaking. Here's option number 2, where actually, Ariana, would you describe this one, please? I don't want to misspeak for your thinking.
Sure. I was trying to think of a way to, and bearing in mind that all of these are just suggestions. This proposition 2 is applicants ranked by the reviewer average. So you'll see over here, like Daisy Chain had, both of the reviewers gave it a high score of 30. They have a 12 priority ranking, which means that they are culturally sensitive, Medicare, et cetera, et cetera, et cetera. And so their rank, when those two metrics are combined, is 42, which is like a perfect score as far as the application goes. So that, using that metric, I was able to prioritize and just keep adding agencies in until we got to a reasonably close number, which is at 70% funding, it's $40,000, and that is 1,100,000 over, which is possible to whittle down there. The one exception I did make in my thinking here is that I did not apply a 70% decrease, I mean a 30% decrease to ideal option because their total ask was so small that that would seriously damage their ability to function. So once again, this is simply a suggestion of how to take all the knowledge that y'all have imparted in reviewing all of these and make it useful in sort of whittling down this really, really hard choice that we have.
Sorry, Anna, was there a third option as well?
There
I know
is a third, but it's a little wonky. Is there a slide for that one?
There probably is. I didn't want to click and it be the end, then have to back out and start.
Oh,
over.
yeah, no, go ahead.
So yeah, Ariana's point is really sound. These are recommendation is a strong word. This is just talking points about how you all might want to think about how to make this really, really hard recommendation to the OAC. And we've been facilitating those meetings and it's been really helpful for them to really see your deliberation and understand the thinking. So thank you for this.
Okay, if you basically what I did for Proposition 3, I'm just going to talk about it really quickly, is bring the cap down to 4 million, which is not something that, and I didn't make a slide for it, but I can show you on my spreadsheet if you want. It was sort of a theoretical modeling of it. So I would say just disregard it and talk about what
was
presented.
I'm going to try to agitate our conversation forward. So I'm just going to say it. This sucks. Is really hard. There's no good answer. Yet we have to make one, right? We have to make a recommendation. And so based on what everybody has heard today and Tuesday Monday, the last time this week we met to talk about Lane County, please share your reflections and where you would like to start this conversation. Yeah, please somebody unmute and give us some thoughts. And thank you, Ariana, for giving two starting points. And I'm going to make this a little bigger so folks can actually see what it is. Where do you want to start? Dana.
Can I see number 2?
Of course. Thank you for putting yourself out there. Dharma? Hi, Dharma.
Hi, Abby. I was wondering if folks could tell me, and I apologize for not being able to watch the video from Tuesday or whatever, but folks could tell me about the peer support cost for Daisy Chain and why they're so much higher than the rest of the applicants. Or if there was conversation around that.
Sure, I was one of the reviewers for Daisy Chain, and they're very, very specifically focused on pregnant persons and supporting them. And they often I think they're fairly unique in terms of they have a birthing center and doulas, and they do work with SUD and dual diagnosis folks.
Do they have numbers for patients per year or peers per year?
It is fairly low because the services that they provide are so intensive. I will pull it up right now.
I do have that in front of me here.
Kathy, go for it.
Okay. On the proposed budget, they're looking at 3 FTE peer doulas that start at year 1 at 204,000, and it goes up to 644,000. There's also a peer doula team leaders at 1.8 FTE and a peer at 1.5 FTE, doula team leader at 0.5. And altogether over the 4-year period, just for those that are in the doula, we're looking at 2.8 million.
Thank you.
Yeah, thank you, Kathy.
And thank you for the questions. And we're looking at, the column on the far right is a far cry from the total ask for most applicants, right? So even for Daisy Chain, which was 3.5. All right, other thoughts? suggestions about how to get started on this hard situation y'all are in, we are in? I think there's a really terribly easy way to think about this. One is we look at trying to fund every single existing partner to try to keep the network intact, but you reduce the total grants. That sucks. Or you remove some of the existing partners who already have stood up services and try to keep these already reduced amounts intact, which also sucks. But the conversation about thinning this soup is real. And yeah, I'm just going to leave it at that and let Dana take over.
I was just wondering if you had a spreadsheet of all the new entities that we're proposing, just because right now we're just looking at the existing. I'm just seeing what I would like to see what has been removed and what we're, if we have like a side by side of here's all the existing, here's all the new.
No, we don't have a side by side other than these kind of home base slides.
Mhm.
So the new applicants are the ones in white.
Yeah, it's just hard to see what, because like option 1, option 2 is only the existing, so it's hard to see what we've cut out at a glance, if that makes sense.
Yeah, I apologize for that. I did it that way because it does seem like the OAC's default is funding existing burns, but
Well, let's maybe and Ariana, I know you've got spreadsheets up, maybe something that's something you could cobble together real quickly while I fill some space talking to Amy and Dharma.
Yeah, just
Always
one more thing, and was 4D the only one specifically offering services for youth? I can't remember who all the other
no.
youth
Looking
ones
Glass.
were. Looking Glass. It was Looking
Youth
Glass,
Era.
yes.
Youth Era.
Yeah, Youth Era, Looking Glass,
Laurel Hill does as
and
well.
Laurel Hill. Okay. All right. Thank you guys. Thanks for prompting my memory.
So do folks want to take a look at a spreadsheet of the new grantees, the new applicants, I mean?
I do want to say that based on like our conversations in the OAC that and based off of those applications here that I would lean towards the existing providers because I know that's how it's going to go, and so I don't think it's really going to be as practical to really nickel down those newer providers because I don't think they fall in line with the council's values on what they're going to fund. I think that there's not any unmet culturally specific service needs that are that would be lost by excluding those new providers. So I think by sticking with the existing providers, we would be meeting the needs. Just for yeah, just see that perspective. I don't know if you can go back to the last slide, Abby.
Which last slide? The slide of the second recommendation?
The first, yeah, just the very
previous
first one. I'm
one.
sorry.
No,
I just
no.
wanted to make sure of that one that the new ones, yeah.
There we go.
Yeah,
This is the one.
one more. Yeah, no, I agree. Yeah, I stand by that. Yeah, I think that we should look at the existing providers only, and I know there's still work to go there, but I just wanted to level set with folks.
If I could, one application for a new thing that stood out to me is Black Thistle Street Medicine. They are actually filling something that I don't think anybody else is doing. CORE is close to doing what they're doing. But they so Dharma, in that sense, you are right that CORE does do street outreach and street medicine, but from reading their applications side by side, Black Thistle is going out into the community in ways that CORE doesn't have the capacity to do. So that's a I just wanted to voice that in the meeting for people's
Was
consideration.
Whitebird on there too? Was Whitebird being included as an
White,
existing provider too?
that's true. Whitebird is on there as well. And so, but they tend to have people come to them instead of going out to people. But both Whitebird and Core definitely in their applications have pointed out the work that they do with meeting people where they are.
So I'm gonna take us back here. It's 11:30 and we need to move. So suggestions. What would you like to see? Tammy.
I'm kind of leaning towards the potential 2. It's a little bit closer to the budget and it still funds the majority and gives you a nice burn.
And Ariana, which are there existing providers that are not on this list? There must be.
Yes, there are.
Which is something I would want Amy and Dharma to. Great.
So actually, if you go to the next slide, Abby, I
Oh,
believe,
there it is.
yeah. So Restored Connections and Shelter Care are on proposal 1, which is way over, and Restored Connections and Shelter Care are not on proposal 2, and that was based on their low reviewer scores in the rank. And that is why they were excluded, because if you look at Restored Connections, they have 2 of their areas were not recommended. And
Those were actually not, those shouldn't have been on there.
those shouldn't have been on there. That's correct.
Yep.
So then there's that program cost, and then Shelter Care had a priority rank of 9, which is lower than everyone else.
So the only service area that was correct for Restored Connections was peer support, right?
Yeah, and that's you
correct.
can see that here on the spreadsheet is it's just a pure application for 5 million.
That's so much. I don't see why. I think the council would end up looking at that and feeling the same way. With the 5, I guess, was there any justification for whether it was 5 million in their peer support? Or I guess it was in their program cost, but like it was all going towards peer support.
You can have someone pull up the budget and say a bit more about that.
Does anyone feel
So
strong
this
about
is a
maintaining them?
it's a peer focused model, and they really focus a lot more on housing, like transitional housing support for after released from detox and supported employment. So they do a lot of employment support and peer professional development, and then medical access and zero barrier drop-in services. So their services offered don't really align specifically with our categories that we're looking at here.
Sure. Okay. That would make sense to me then to I guess the final one. They're all terrible decisions how to make, right? But I think that that makes it makes sense to prioritize removing Restored Connections. Shelter Care Shelter Care was the other one that was on there. What was the rationale for removing Shelter Care? Just the low rank?
Yeah, that was it. That was in trying to get down to a reasonable number. Because everybody was sorted by rank, which is a little hard to see here because I did re-alphabetize them just so that we weren't like at C with what we were looking at. Their rank was the lowest of all of them at
Are they a
35.
culturally specific service provider?
They're not.
Okay. Go ahead, Amy.
Dharma, Shelter Care also stated in their presentation that I read that they are able to build their housing out to the CCOs and stuff. So, I mean, they're pretty self-sufficient. I think they're trying to add services, more pods, more beds, but I just wanted to let you know that.
Well, before we lose quorum, then I think that that makes sense to me. We should look at the potential too. Then I would think.
And it's a million over.
I'm gonna go over to my phone so you guys don't lose quorum. I just have some tests at the hospital I have to go do, so I'll be on my phone till noon.
Thank you, Amy.
As important as the specificity is, I'm wondering if we could look into reducing the amount for daisy chain if their singular FTE is so high. I don't know if it could be taking out one of those FTEs, or it could be looking at having them negotiate how much they could reduce down from a certain amount. But I think that's where I'd gravitate towards first.
So
Then also looking at the housing costs for housing our veterans, but I don't think there's any.
on this slide, look over to the right with the
Uh-huh.
70%, right? So you've got 1, 2, 3, 4, 5, 6, 7 applicants already pushed down to 3.5 from their initial asks.
Okay.
So, I mean,
Sorry. Point
those
taken.
could be brought down more. You could make some recommendations elsewhere to decrease. So if you want to, offer Dharma that you would ask Daisy Chain to decrease their NTE to 3 million or 325 or something, that's of course on the table, but thinking about all of these applicants and how to build this burn as well as possible. One of the things that OAC was working on last night, and we'll work on again tonight, is if 70% doesn't do it, what will do it? And I think in one case we went even down to like 58%, which is again awful. But it was able to retain funding for folks who stood up programs 3 years ago.
Does the 65% make a difference?
Please hold. Let me figure that out.
Holler if you want me to give you the screen sharing baton, Ariana.
If you'd like.
We have another question in the meantime, Tammy.
Oh, sorry. Go ahead, Tammy.
Areas, or was it all, what areas were they expanding into?
Yeah, let me pull it up. Hold on. I have way too many windows open. I'm gonna stop sharing. Since we'll probably look at some map. Oh my gosh, suddenly I have like things I can see. Let me pull up the application since I reviewed that one, and so did Rachel.
I'm gonna switch to my spreadsheet, Abby. Maybe. Yes.
Yep, it's working on it.
All right, so Dharma, this is now 65%. And you can see that it's actually 1.9 million over. So that's encouraging.
Okay. Gosh. Sorry, just need a second.
I don't see notes standing out to me about adding new services, but I feel like they're adding new staff. That feels like where the bulk of their budget has been. So it could be just trying to increase capacity at their existing youth shelter and some of their other services.
Okay, try to get to the capacity to even spend down what they had before.
May I make a suggestion in the interest of time?
Sure.
My suggestion is, oh, sorry.
Liz's hand is up as well.
Oh, sorry, Liz.
I was just gonna say for Looking Glass, I would recommend reading the past recipient tab. I think that might help understand the ask.
My suggestion was going to be to pass Proposition 2, which seems to have the most support, over to the OAC, and before it is presented to the OAC, I can dig in and find out where exactly the new expansions from existing partners are being proposed and mark those for the OAC.
Maybe specifically Looking Glass.
Let me make sure that before we do that, we read a little bit more about their past recipient and the spend down. Sorry, it's a long sentence. And so, okay. Due to receiving a community development block grant for renovations from the city of Eugene prior to receiving our Measure 110 award, we did not end up needing as much Measure 110 renovation funding, and we received approval from OHA and the council to use it for additional staffing in response to being at full capacity every night with a wait list. So that's additional information on why they still have some funds remaining.
That's a really high housing difference, housing funding difference, though. I don't, but they get marked down to the 32. So I think that makes sense to move this forward just as is, but I don't think that the expanding services is going to be as impactful of an assessment of where to add things back in. So I think the 65 would make sense. I don't know if we can increase that 65 up to 67 or something to try to get it closer.
We certainly can. Would you like me to do that now, or would you like
I
to?
don't know if we can do that in the OAC later, though. I think this would
Alright.
be a comfortable recommendation to move forward. I'd propose, I'd motion to send this over to the OAC at 65%.
I would second that.
Okay.
Okay, so let me add my math. Actually, it's fine the way it is. So 65% has been applied. You do have 1.9 million to figure out what to do with, and that's encouraging.
So Dharma moves to move forward with funding
Prop 2.
Proposal 2 at a 65% funding level, having the OAC reallocate any remaining funds. Sound right? Okay, and then I think both Amy and Tammy seconded.
Correct.
Okay. Discussion? Okay, hearing no discussion, Carly, let's do a vote.
Hey, Amy, how do you vote?
Yes.
Dharma?
Yes.
Keisha didn't come in late, did she? I don't think so. Morgan? Oh, Zeb, did you make it? Abby? I'm sorry, was that a yes?
Sorry, yes.
Okay, thank you. Ariana?
Yes.
Anaim? Dana?
Yes.
Daniel?
Yes.
Danielle?
Yes.
Did Drew join? Elizabeth? I think she's out too.
No, I'm here.
Still here.
I'm here. Yes.
Thank you. Gregory?
Oh,
Carly, can you hear us?
Sorry, I froze. I'm sorry. Gregory, are you here?
And he's a yes.
Thank you. Greta?
Yes.
Hannah, did she come in? John? Juliana?
Yes.
Kathy?
Yes.
Kylie? Is she still in here?
No, she had to go do an
Okay.
interview.
Oh, that's right. Liz?
Yes.
Mark? Mark, if you can't unmute, you can put it in the chat.
Yes, can you hear me?
I
Hello?
can
Yes.
now. I can, thank you.
Super.
Maya?
Yes.
Michelle?
Yes.
Nicole Corbin?
Yes.
Nicole Egler?
Yes.
Rachel?
Yes.
Sean?
Yes.
Stanley?
Yes.
Tammy?
Yes.
Tatiana?
Yes.
I think Tim stepped out. That passes with 23.
Thank you, everybody. That was really hard. And we got some more hard work ahead of us. With only 15 minutes to go, it is not worth jumping into a new county. But I do want to share that we only have one more meeting scheduled together. And I have some curiosity about whether we're going to be able to complete Union, Yamhill, Washington, and Multnomah counties tomorrow. So that means we're going to need to find some time to meet next week. That means Carly's going to have to find us some time to meet next week. Thank you, Carly. It is what it is. We have until the 21st, and I think we're going to need to figure out how to come back together early as possible next week. I know it's Monday's a holiday, because the OAC has been able to make their decisions pretty quickly because of this type of deliberation, as I've already said. So I think the only thing in front of us is making sure that our reporting out is really concise. So please use the tool that Ariana shared. Thank you, Ariana. If you can't find it, it is in the chat, but I sent it via an email. If you need it again, please let me know. And so just remember, if the question is, if someone applied for peers, the question is, are they applying to work in the field or in the office? Yes or no, right? And if there's something that you're like, wow, I really want to share this, or I'm really worried about this, or I'm really excited about this, please feel free to add that. But let's avoid reading whole answers and just make sure we're giving good summary and also sharing any concerns or excitement about what is being proposed. And then I hope that will enable us to get through in a timely manner, because we do need to go back and negotiate these and then get all the information to contracts to do their grant agreement administration work. Questions or comments before we close? Okay, we're going to jump back in tomorrow morning and we're going to start with Union and Yamhill. Washington and Multnomah are coming up next. Thank you, everybody.
Thank you.